Learn these sentences for OET speaking be great. 1. I do perfectly understand your anxiety. Because it is your first surgery. Let me reassure you that we will care you at every step that is before, during and after the procedure. 2. Your concerns are reasonable. However, there is nothing to be alarmed about the surgery, it will be performed under injection. That means you won't experience any pain during the procedure. Even after the surgery, the post-operative pain will be managed effectively with the help of medication. Is that clear? 3. I can sense your anxiety about coping at home after the surgery. If I were you, I would react the same way. 4. You don't need to be worried because you will be provided with comprehensive support physically psychologically after the procedure. 5. Try not to worry, we all are here to help you. Your health is our priority, you will be provided with physical and psychological support after the surgery. 6. The stomach care nurse will visit you in the evening. She will give you the instructions regarding colostomy care, the equipment needed, and the diet after the surgery, so that you won't feel completely dependent on someone for the care. Is that okay? 7. Well, I hope you are already aware about your condition, that you have got an infection in your brain. There is pressure inside your brain, which is called intracranial pressure. In your case, there is a chance for elevating intracranial pressure, but we want to maintain the pressure in normal range. That's why the doctor has advised to elevate your head and with pillow. Is that clear? 8. I do really understand it might be difficult for you, but your health is our priority. If you follow the instructions, you feel better. Also, it will enhance your recovery. Otherwise there may be chance of getting severe complication. Is that clear? 9. You have been prescribed by intravenous antibiotic injection. It's like a 1-week course. You need to continue this injection 5 more days. Once you finish with your antibiotic course, we will change to tablet form. Then you can go home and take rest at home. 10. I know it might be difficult to cope with the hospital environment. For the sake of your health, we are insisting you to continue the hospital stay. If you are in this hospital, we will continuously monitor your condition and will provide you proper care. So, it is always better to be in this hospital, so that you can recover from this illness as early as possible. Is that clear? 11. Alright, Miss Maria, I do perfectly understand. It might be really embarrassing. Especially you are a college-going student, but try not to worry. This redness is very common in people who are very fair. 12. There is no permanent treatment for this redness, but we can control your symptoms. We can control further occurrence of this symptoms. They will definitely go off if you follow our instructions. We have successfully treated many cases like this. 13. It can be controlled with face cream and tablet. Also, you need to focus on dietary modification. 14. It is really important to use the face cream or sunscreen lotion whenever you go outside. It is recommended that do not get exposed to sun when it is hot. Is that clear? 15. There won't be any chances of side effects, as long as you take medication. 16. If you follow some dietary modification, which will really help you to control this condition. You need to avoid spicy food products, alcohol, smoking, and all these things. Because all these may trigger your condition. 17. Small changes in your diet can really help you a lot. 18. Please make sure that you take the correct dose of medication for a couple of weeks and use face cream as suggested. Also, some dietary modification is needed. 19. Once again, I assure you that if you follow our instruction, you will be all right. 20. It is understandable to feel worried in this situation. I know it might be difficult for you to cope with the situation. Try not to worry. We are here to help you. 21. Asthma is a chronic disease of airways, which means narrowing of airways in your lungs, so that air will not pass into your lungs. That's why you are getting breathing difficulty. 22. Asthma occurs due to environmental factors and inherited factors. Environmental factors means dust, pollen, chemicals, and strong smells. 23. Most of the people get asthma due to environmental factors. 24. I can sense your anxiety. There are lots of treatment available nowadays. With proper treatment, we can effectively manage your condition. The best treatment is Ventolin inhaler usage, and I will teach you how to use this inhaler. Is that okay? 25. Don't worry, I will give you the leaflet which contains the usage of inhaler and the pictures that will be very beneficial for you. 26. I understand you are really worried about the inhaler usage. There is nothing to be alarmed about the inhaler. This is the best medicine for your condition. You can use this whenever you get any breathing difficulty. Otherwise, please don't use this, so that you won't be addicted to this medicine. 27. I assure you that if you follow our instructions, definitely you can control your asthma. 28. Most people with asthma achieve good control of their symptoms with these medications and are able to lead a normal life. 29. Cholesterol is a fat-like substance in our blood and most of the tissue. There are mainly two types of cholesterol. First one is high-density lipoprotein or HDL. It is very good for our body. The next one is low-density lipoprotein. That is LDL, that is not good for our body. Whenever our LDL increases, then we have high level of cholesterol. Is that clear? 30. Cholesterol occurs due to our unhealthy lifestyle along with heraldry factors. For example, intake of unsaturated fat in the diet, have the habit of smoking and not doing any exercise. These all will definitely cause high level of cholesterol. 31. It is really important to reduce your cholesterol levels, because these fat substance can lodge into your blood vessel and can cause severe complications such as heart disease and stroke. Is that clear? 32. First of all, it is really important to take the medication as per our instruction. Along with, you need to avoid unsaturated food, like red meat and dairy products. 33. Please include more fruits and green leafy vegetables in your diet. 34. Along that, you need to do simple physical exercise, like walking for 15 minutes a day or climbing the stairs. These all will be really helpful for you. 35. Kidneys are the excretory organs in our body. The main function of kidneys are to purify our blood, which contains waste products. 36. If kidneys fail to function, there won't be any purification of blood, so that waste materials will be lodged in our blood. 37. The first and foremost treatment for kidney failure is dialysis. 38. Dialysis is a process of purifying blood artificially with the help of a machine called dialyzer. 39. The impurified blood from your body will be pumped into these dialyzer machine. Then inside the machine, the blood will get purified and it will be reverted back to your body. 40. I am so sorry to tell you that, once the kidney fails to function, it cannot be revert back to normal. It's really important to continue dialysis until you get a donor for kidney transplantation. 41. There is nothing to be alarmed. Let me explain to you that there will be mild pain initially when the needle inserted into the blood vessel. But I am sure this can be easily managed. 42. There are chance of getting some side effects, such as fatigue, low blood pressure and muscle cramps. 43. Don't worry about the side effects because we will take proper measures to reduce your side effects. 44. I am afraid, if you do not undergo dialysis, you will become very ill. 45. The waste product will accumulate